The hormone responsible for the development of the ovum during the menstrual cycle is A. Estrogen. B. Progesterone. C. Follicle-stimulating hormone, FSH. D. Luteinizing hormone, LH. Alfred Binet is associated with A. Personality testing. B. Intelligence testing. C. Aptitude testing. D. Down syndrome. Insulin is not administered through oral route because A. It caused git bleeding. B. It caused nausea and vomiting. C. It is destroyed by git. D. None of these. Infusion of 500 milliliters normal saline over 6 hours requires how many drops per minute when the drop factor is 15 drops per minute? A. 15 drops per minute. B. 21 drops per minute. C. 23 drops per minute. D. 17 drops per minute. Bone consists of A. Water. B. Calcium phosphate. C. Osteoid. D. All. The nurse is teaching parents to administer eardrops at home. Which action will indicate that the parents understand? A. Request that they list each step of the process. B. Ask the parents to describe the procedure. C. Watch as they administer the eardrops. D. Quiz the parents on the medication handout. A 68-year-old client is diagnosed with a right-sided brain attack and is admitted to the hospital. In caring for this client, the nurse should plan to A. Use a bed cradle to prevent dorsiflexion of feet. B. Use hand roll and extend the left upper extremity on a pillow to prevent contractions. C. Do passive range of motion exercise. D. Application of elastic stockings to prevent. What type of chest tube system does this statement describe? This chest drainage system has no water column to control suction but uses a suction monitor bellow that balances the wall suction, and you can adjust water suction pressure using the rotary suction dial on the side of the system. It allows for higher suction pressure levels, has no bubbling sounds, and water does not evaporate from it as with other systems. A. Mediastinal chest tube system. B. Wet suction chest tube system. C. Dry wet suction chest tube system. D. Dry suction chest tube system. A 10-year-old child with asthma is treated for acute exacerbation in the emergency department. The nurse caring for the child should monitor for which sign, knowing that it indicates a worsening of the condition. A. Respirations of 18 breaths per minute. B. Pulse rate of 90 beats per minute. C. Decreased wheezing. D. Warm, dry skin. Aim of nursing education is A. Physical development. B. Mental development. C. Vocational development. D. All the above. Which of the following drugs are not compatible when taking probanthine? A. NSAID. B. Caffeine. C. Acetaminophen. D. Alcohol. The likelihood of HIV being transmitted from a pregnant woman to her infant in the absence of antiretroviral therapy is about A. 40 to 70%. B. 10 to 40%. C. 20 to 25%. D. None of these. A client with chronic schizophrenia receives 20 milligrams of flufenazine decanoate prolixin decanoate by IM injection. 3 days later, the client has muscle contractions that contort the neck. This client is exhibiting which extrapyramidal reaction? A. Akinesia. B. Dystonia. C. Tardive dyskinesia. D. Akathisia. In Maslow's hierarchy of physiologic need, the need of greatest priority is A. Nutrition. B. Love. C. Care. D. Oxygen. Which immunization produces a permanent scar? A. BCG. B. Hepatitis B vaccination. C. DPT. D. Measles vaccination. An instrument placed against a patient's chest to hear both lung and heart sounds. A. Sphygmomanometer. B. Otoscope. C. Stethoscope. D. Telescope. Case finding in RNTCP is based on a. Sputum culture. B. X-ray chest. C. Sputum microscopy. D. Mantoux test. A client wakes up during the night and asks for something to eat. The nurse aide should a. Tell the client that eating is not allowed during the night. B. Tell the client nothing is available at night. C. Check client's diet before offering nourishment. D. Explain that breakfast is coming in 3 hours. The effect of the drug on parasympathetic function declines rapidly in all organs except a. Eye. B. Heart. C. Smooth muscle organs. D. Glands. The average length of the umbilical cord in human is a. 35 centimeters. B. 45 centimeters. C. 65 centimeters. D. 55 centimeters.